All right, so as was mentioned, I'm Leslie Enane. I'm at Indiana University, and I'll be talking about this work that we did in the AYANI cohort of IeDEA, speaking about potentially traumatic life events and their associations with mental health and HIV outcomes. So youth living with HIV have overall worse care cascade outcomes compared with their older adult counterparts. And we know that mental health comorbidities in this age group are a major barrier to HIV care and a major target for intervention. Youth may face potentially traumatic exposures, or PTEs, from violent or potentially life-threatening experiences, which can impact their mental health as well as their care engagement. However, there's limited data on these experiences of lifetime experiences of potentially traumatic exposures among youth with HIV globally. And so we sought to assess both the burden of these kinds of traumatic experiences or potentially traumatic experiences and the forms that they took among young people living with HIV in this global cohort. This is a cross-sectional study that we did among youth who were first enrolling in the Adolescent and Young Adult Network of IeDEA, or AYANI study, across 15 sites in 9 low and middle income countries across several global regions, as you see here. This is a prospective cohort study of youth at HIV clinic sites in 6 regions of the global IeDEA consortium. It includes youth who are living with HIV, ages 15 to 24 at enrollment, and who are fully disclosed to regarding their HIV status. They are youth enrolled in treatment with at least 1 visit in the preceding 6 months and providing informed consent or assent to the study. And these data that we will present come from in-depth assessments carried out in this cohort on their first enrollment visit. And we ascertained lifetime potentially traumatic exposures from the life events checklist, but also from the adapted WHO sexual health survey, as well as some socio-demographic questionnaires. We looked at mental health using symptoms of moderate to severe depression or anxiety on the PHQ-9 or GAD-7 respectively, and also post-traumatic stress using 2 different scales depending on the age of the child or a young person. And then HIV care outcomes included missed medication doses, missed ART dose, and of at least 1 in the previous month, and non-suppressed viral load of at least 200 copies. We grouped the potentially traumatic exposures by type, again using variables from those questionnaires, and we looked at some bivariable associations between those forms of PTEs and the mental health and HIV outcomes of interest, just using chi-square tests. And we did explore some combined exposures to look at the associations with these, again using a cross-sectional analysis. So these data are from 666 youth participants in the study at enrollment. Median age of 19, 48% identified as women, 45% as men, and 7% as other identities or non-binary, and 84% with route of HIV acquisition as perinatal. Overall, we saw very prevalent PTEs, or potentially traumatic exposures, with 21% with personal experiences of physical violence reported, 17% reporting some form of sexual violence, and then others that you see here, 26% that had witnessed violence, and then of course very high experience of severe illness or of witnessing disasters or accidents, and overall nearly 80% had any form of a potentially traumatic exposure. There was some variation by gender, so in particular sexual violence was reported more commonly among those who identified as women or as other sexual or gender minorities. And then in terms of our mental health and HIV care outcomes of interest, 9% with moderate to severe depression, 9% with anxiety, and 10% with PTSD or some form of post-traumatic stress. 44% had missed doses in the last month, and 31% with a non-suppressed viral load. And overall, we saw that in particular, physical violence and sexual violence were associated with depression, anxiety, and post-traumatic stress, with physical violence additionally being associated with missed doses in the previous month. We also saw that other than witnessed violence, other forms of potentially traumatic exposures were associated with depression. Witnessed violence was associated with PTSD, and we saw as an association of severe illness with anxiety and also with missed doses. Again, just an initial bivariable analysis for each of these. And then exploring some combined exposures, 6% had both reported sexual violence or physical violence exposures or personal experiences. And as you see, those were associated with all of our mental health outcomes as well as with missed doses. And then reported combined exposures of sexual violence and war or conflict were associated with all of the mental health outcomes of depression, anxiety, and post-traumatic stress. We did not see an association for any of these forms of exposures with viral non-suppression in this group. So in conclusion, we found that lifetime potentially traumatic events were quite prevalent among youth with HIV across these diverse country contexts, that in particular experiences of sexual violence and physical violence were associated with symptoms of depression, anxiety, and PTSD, with physical violence additionally being associated with missed doses, and that other forms of potentially traumatic events were actually quite common and demonstrated the burden of these kinds of exposures in this group beyond those key exposures of violence. And overall found that interventions to address trauma are needed, and much of what many of you all are doing. So thank you for your time and attention. And many thanks to the youth who participated in this cohort. Thank you.